this is Congressman Luetkemeyer. Thanks for joining us again for another edition of the Blaine Buzz. This week we'll talk a little about health care. I know it's still in the news, it's still on everybody's minds. Last week we had the Healthcare Summit here in D.C. and the President and our side of the aisle sat down and tried to work out differences between them on this issue. Obviously there was a large discrepancy between the two. If you watch the debates or the discussions at all, you can see that the President and Nancy Pelosi and Harry Reid still want to go down the road of a big government approach, a big government solution to this problem. We as Republicans believe that we need to have some health care reform, but as you can see from the debate, our ideas center more on the private sector solutions. We believe that we don't need to have a broad brush approach to this healthcare situation. We need to have a more targeted and a more incremental approach, and we think we've got a lot of great ideas. And if you're watching the debate last week, you can see that we have lots of ideas on a variety of areas of healthcare that can lower costs, continue to improve healthcare, and put you and the doctor in charge of your healthcare best needs and decisions. This week the President's come out and he's made a decision that he's going to ignore what our ideas were, try and put a couple of them in there, and then try and ram home this big broad brush approach to healthcare, a government takeover of 1/6 of our economy, and try some parliamentary moves to try and move this piece of legislation. I don't think at this point they've got the votes, but who knows, we'll see what happens. But at the end of the day, this is not the way we need to be working. I think you can see that we as Republicans have been listening to people. We have watched and listened to what your concerns are, what your ideas are, and have put them into some legislation. The President and his group continue to ignore the American people, continue to ignore what they want in the changes in health care, and as a result are going down a track that nobody wants to go. The American people don't want to go down there, we don't want to go down there. So what we're going to have to do is try and continue to stop this train and hopefully get it turned around and then allow the people's voices to be heard with the legislation proposed later on. So stay tuned. This issue is not over. It's going to continue to be debated and discussed and voted on sometime in the near future. Continue to contact our office with your views and concerns about it. We want to hear everybody's point of view, and as we get closer to the vote, we'll certainly take those into consideration. But I'm sure you can tell from my discussion on this issue, and apologize for getting a little long in this Blaine Buzz, but this is a big issue. To me, this is a very, very important issue. We must not continue to go down this road of bigger government. We need to let the people control these things, and that's where we're going to come down on our vote. Thanks again for joining us. Look forward to seeing you next week.